If you're wondering how to navigate government or grow your business or even secure funding for your nonprofit, then this is the podcast for you. Here on Lobbying Insider, we take a look at the intersection between business and government and show how things actually get done. I'm your host, Zack Fink, Director of External Affairs at Davidoff, Hutcher & Citron. Welcome to the program. And we're joined by Alicia Paladino from Palco. Thanks for coming in. We appreciate it.
Yeah, thank you for having me, Zach.
I do want to talk a little bit about this initiative involving maternal health. Give me, if you could, just some broad strokes on why this is significant, what you're trying to do in different states.
Sure. So, first of all, in this country, the mortality rates and morbidity rates for women are horrific. And a lot of the initiatives around the country are very focused on clinical outcomes, and a lot of the money that states are spending are all around clinical outcomes. And in what we're trying to do is bring it back to the community. So a lot of health initiatives can really come back to social determinants of health. And what those are just how your environmental factors, social factors, income levels, all of these things can really impact health. And especially for pregnant women. So what we do is we provide a team of navigators, and we also have a social determinants of health screening tool. So what we do is we go out and we talk to the moms, and we find out what the problem is in the home. Maybe they need access to housing, or there's a food shortage, or some other problem. And we also learn about if they have any chronic conditions or things like that. So we build this care plan. We figure out what the problems are. We build a care plan, and then we execute on it. And our navigators call the moms and make sure that they are going to their prenatal appointments. And all of those things are really important because even the moms just going to their prenatal appointments means, NICU births are down by a third and ER visits are cut in half. So it's a really important initiative to help improve the outcomes for the moms and for the babies and just give them the best possible start.
Right. You'd think with all these years of dealing with pregnancies and children and society that it would be much more perfected. But I guess it varies so greatly, not only from state to state, but income level to income level and depending on where you are socioeconomically.
That's right. Yep. And even urban areas are very different than, some rural areas, right? And in a lot of rural areas across the country, hospitals are closing down. So if, a woman has gestational diabetes or something that she needs, treatment for, she might have to drive 100 miles, right? And that is a very different problem than, an urban center. There's also, women of color are greatly double as the impact. The mortality morbidity rates are twice as bad for them. But yeah, you're right. There's all this data out there, but again, all the initiatives have been really focused on clinical outcomes and not so much around the community and, doulas and lactation consultants and all these real life things that we need as moms.
And you'd say, obviously, poverty is poverty and not having means is not having means. But to your point, I think it varies so greatly depending on region, depending on what's actually going on. Some states probably provide much better services than others, right? There's probably great disparities when it comes to that.
There are, but it's surprising how in most states, there's really not a good hub for women to access these resources. Pretty much no state has a good hub, right? And there are things out there. There's WIC, there's community resources, there's all kinds of programs and things that Medicaid pays for, but it's just accessing them. And it's a very fragmented system. So, you take a mom who maybe has, a full-time job. She's the single breadwinner for her house, and she's got kids already. And now she's pregnant, trying to, navigate this system. It's an impossible ask, right? It's very hard to figure out how to get WIC, to get formula, or diapers or whatever.
Covering news in New York State for so long, that was one of the challenges was they had all these wonderful programs that were designed to help people who needed help. Gaining awareness in certain communities about their existence, even knowing how to begin to access something like that can be really, really challenging.
Right, exactly. And marketing all of these initiatives is a big problem. So we see some states that are putting efforts towards all of these campaigns to get the awareness out that these programs exist. But so that's the first thing. But then again, once they do find out about them, it's getting enrolled, which sometimes can take months.
Right.
And, if you're pregnant, you can't really wait months to get, services.
And is enrollment complicated, or is it just time lag because things are not efficient and a well-oiled machine?
It's that very much that it's inefficient, but it can be hard to understand too. You might have to have 50 pages that you have to fill out to get access to this one program, right? And so we know how to do that. We know how to get these moms on these programs. And we also have a hub ourselves where, if you're a mom and you're looking for a doula, we've got a registry. You don't have to go out there and search the internet and, try to find out as much as you can to hire this doula. Like, we've got all the information in one centralized hub. It's kind of a one-stop shop.
A one-stop shop to help people find and get to the respective services that they need, which might be hard to actually locate. I mean, we talk a lot about financial literacy and individuals who may not understand how to utilize the resources to read the documents that they need to read and be eligible for certain programs. And I don't know what the word would be for health. But it's a similar kind of thing, I would imagine, which is that knowing where to look, knowing what the program is even called, knowing that it's available. I mean, that's got to be challenging for a lot of people.
It is. And then, in addition, it's very easy for women to think, okay, well, this is fine, right? And, maybe they think, what's the harm in, skipping my vitamins or skipping a doctor's appointment? And, we also bring awareness to those situations too. It's very important that you take your vitamins, that you cook healthy meals, that we deliver those meals to you or whatever it is, or go to your doctor's appointments, just because of the downstream impacts are just so great, right?
Well, and even the education of pregnancy and taking care of oneself. I mean, I recall having health class certainly in school, but I don't know that it necessarily the information gets down with the emphasis that it should to every single person, right? About just how an essential period that 9 months is and doing simple things that you're talking about, eating well, getting rest, making sure that you're doing regular checkups. I mean, that stuff makes such a difference.
Right. And you don't hear that stuff at your doctor's visits always. The doctors are going from one patient to the next. So again, it's very clinical and there's nobody there to kind of coach and navigate these women. And then plus, postpartum, I mean, I've had 2 kids and, the first one was such a shock to my life and it was such a huge change. And, I'm a woman of means. Not everybody is, right? I work in this space and I still found it to be very overwhelming and difficult. And, that's a time in women's lives when, there's a lot of suicide, postpartum and a lot of that comes from, chronic conditions or not having the support that they need. And 86% of all the deaths that happen in the 12 months after the baby is born, 86% of those deaths are preventable just from simple things, the social determinants of health.
I was going to ask about that, right? Because that's another thing that you hear about a lot of those cases, and that seems to be the point where resources run out, right? Where it comes to there's already a stigma in this country about mental health.
Right.
But certainly after someone has a baby, the expectation is they're thrilled, they carried the baby to term, the baby's healthy, everything's great, but that's when people can have, mental health issues, right? Right after a birth.
That's right. And there's this expectation, I think, a lot for women, at least I faced this, where you're fine. You have the baby and, all right, come back to work. I get a call within a day to, go back to the office after my second one. So, but yeah, I mean.
We really need you here. I'm sorry.
I know. Unfortunately.
I know you just had the kid, but.
I know. You're fine now.
You'll be fine. Just drop what you're doing and come on in. Yeah.
But yeah, so there's kind of this expectation that everything just magically goes back to normal, and it's not the case, right? And, things happen, baby gets sick, or, there's, lactation problems and, you need a lactation consultant now. You can't wait, 3 or 4 months to get through the system, right? You need it now. Or formula, baby's hungry, you need that now. So.
And is it vary from state to state in terms of the resources that are available to this? Are you able to do it in multiple states? Are some better than others?
It takes a little bit different shape depending on the state and then also who our partner is. So, hospital systems versus health plans, even some philanthropic groups that we work with, it takes a little bit different shape. And there are programs everywhere. Some states, like New York, for example, there's a ton of programs, ton of resources out there. It's just, again, bringing them all together. But some states, there's kind of no resources, right? So you kind of have to build those, get out in the community and build those from the ground up.
And you've been able to do that in some of those states where it's not available? Because, New York is, in terms of resources, New York has, I don't know that they're always allocated fairly or well, but the resources are there. There's definitely a lot of money spent on healthcare, on education. Education being another great example in New York. We spend all this money and yet have very poor rates of graduation and literacy and everything else, given the proportion of the money that we're spending.
Right. Well, I think it all kind of comes back to the root of the problem. And sometimes we just don't address that, right? So, and I keep coming back to this social determinants of health concept, but I think it's so important because your environmental factors, your social factors, your income levels, all of these things have a huge impact on your health outcomes. And as a country, we just have not focused on them. And, now within the past year or two, you're starting to see more of an emphasis placed on those social determinants of health. But those are little things that can really inform, what you need and how your outcomes will be, right? So, if you're hungry and you have a food shortage, your health's not going to be good, right? So we can throw all the money we want at whatever your health issue is, but if the real problem comes back to you're just not eating well or not eating at all, right? We got to solve that first.
100%. No. And I hate to keep bringing it back to the comparison of education, but there are some real parallels and similarities, which is, the more they found out kids were not eating breakfast, for example, or not getting school lunches, you can't concentrate. Or you go back to a family environment that is perhaps so chaotic at night that you can't do your homework in the way that another kid in a suburban environment with a little more care and more present parents might be able to do. Right. So it makes for great disparities in the system. And I would imagine with health, it's even more like that.
It's the same. Yeah, exactly. So with education, there's been initiatives in some places, we need more smart boards or things like that. And it's like, well, in this area, smart boards not going to matter. They need breakfast, right? And that's exactly right. So, but it's the same thing that we see, and particularly, we've implemented these programs in 19 different states all across the country for a variety of different populations. But there's never really been much of an emphasis on women, which is really, as a woman, very disheartening. That it's such an important part of all of our lives, right? That birth of a child, and there's just never really been that emphasis on what do women really need, right? They leave the hospital, they leave the doctor's office, but let's meet them where they are. What do they need to be successful and the baby to be successful?
And that's so important because there's an assumption that the system, it's been happening for thousands of years, and of course this is
we're good.
But also to the same notion, there can always be improvement, right? You can always prevent that many more sicknesses or child deaths or any of these things that still exist even in a country like this one that's so wealthy.
That's right. And in this country, it's not everywhere, but some rates in some parts of the world or in some parts of the country are worse than third world countries, right? As much money as we have, it just shouldn't be that way. And, and nationally, kind of the national average is about half of all births are born on Medicaid, which is, kind of an astounding fact.
It is. Yeah, no, we represented one of the hospitals here in the city that was kind of a safety net hospital, they call them. And it was amazing. The infant mortality rates were extraordinarily high, given where you are. You're in a place like New York City in 2026. It didn't fit. There was something wrong. Something was missing, and they did a lot of external exploration to try and figure out what's going wrong here. Why is this happening?
And a lot of it will come down to the household, just the household, right? Yeah. Not having timely access to food or breast milk or formula, or, maybe the mom's not in a good place mentally, doesn't have the support that she needs. I remember when my kids were babies, just thinking if I could get 3 consecutive solid hours of sleep, I will be fine.
By the way, the answer is no. So
it was no for about 2 years.
Yeah.
But yeah, I mean, and you're just exhausted and worn out, and you don't think right.
You don't think straight, right?
You don't.
And your decision-making process is not as clear as it should be when you're dealing with something like a human life with a child.
Exactly.
Right?
And add on top of that maybe, you're terrified you're going to get kicked out of your apartment.
Right.
You can't work, right? So you're not bringing in the income.
You do all this money in taxes all of a sudden. You don't know where that came from, right?
Right.
Like,
right.
Yeah.
And you're worried about how you're going to cook your next meal. I mean, you have all those added pressures. It's a time bomb.
Yeah. And that many more opportunities for other things that are really important to start going wrong.
Absolutely.
Right? Because I would imagine that it spirals. You mentioned Medicaid, and I did want to ask you about that. Is Medicaid administered in the same way equally in all the states? I mean, is there a formula by which these dollars are getting to the people who need them in each state?
No, not really.
Okay. It's not a uniform process.
It's not a uniform
process. Why would we
process.
expect that from a federal program?
I
right?
have no idea.
Yeah.
I have no idea. But yeah, so it is not a uniform process. Every state operates differently. I mean, there's some things that are kind of similar. And
Well, I imagine by design, meaning like the well-intentionedness of it is to try and make it equal, right? The federal government doesn't start out down a path of let's be fair to this state and unfair to this state, right. But the administration of it and how it actually gets distributed, that first of all, that's politics, right? It depends on who's in power. So that makes a big difference also. But then there's, like you're talking about, which is some of the intricacies of how different programs are set up might be harder for dollars to reach people.
Mm-hmm. Yep. And, right now there's 15 states that have been selected for TMA grants.
What is that?
Which it's a maternity grant that the federal government is basically giving states to, try to implement a program. And what we're seeing still is that a lot of those grants are going towards not the community supports and the real life supports that women need. It's still going more towards like clinical outcomes, but you're solving the outcome. You're trying to solve the outcome and not the root of the problem. So, that's one of the things we're trying to do is get awareness out that, hey, there's community. Like if we engage the community and the doulas and lactation consultants and respite workers and meal delivery places and, for women who can't get to their prenatal appointments, we have transportation services, being this hub and just helping them with their everyday lives, essentially. It's pretty cost effective. It pays for itself. And we're just trying to get that out there to these states that, hey, there's another way, right? Like instead of trying to really focus on the clinics and the hospitals, I mean, you have one appointment every 4 weeks or something. That's not enough. What about the other, 30 days, 29 days, whatever, in the month,
And why do you think that is? I mean, I know you don't necessarily have an easy answer to this, but do bureaucrats just think like bureaucrats? I mean, do they just have to one-size-all-it approach just in order to try and be equitable about the distribution?
I don't know. That's a really good question,
It's
Zach.
a tough one,
it's
right?
It's a really tough question.
Yeah. All right, we'll take some time. Let me know in a few minutes.
Yeah. I'll let you. Yeah.
No, I know that it's a non-answerable, but I do think part of it is an attempt by the government to just think of things in a cookie cutter way, right? They're not thinking about the on the ground work that you're doing, that others are doing, where it gives it a more human face. And they're trying, in some respects, I'd like to think, also to even be fair about it, so that you're not discriminating, you're giving everyone the same shake.
In a lot of places, we also see, this should already be happening, right? Like women should already know how to find a doula or get access to WIC or whatever it is, and it's not that easy, So there's a little bit of this mentality, and we hear this a lot with the self-direction programs we work with, right? Where you have a vulnerable family member, and the family member is the caregiver for that individual. But what we hear a lot of times from some of the bureaucrats is, well, they should be providing that service anyway. Mm-hmm. And it's like, well, I mean, but should they though? Because they've had to quit their job to provide this care, and it's
not
kind
that
of
simple.
the same thing, right? Where it's like, they should just do it. Go out and find a doula. Right. But it's not that easy. Like, where are you going to find a doula?
And that brings it back to the services that you're trying to provide, which are navigation in the sense that they may not even realize that that's what they need, right? Or that it's something simple as nutrition or transportation or basic things that can really set in motion a chain reaction that leads to bad results.
Exactly. Yep.
Yeah.
Exactly.
Yeah. So that's a great thing. So have you run into more problems in certain states than others? I mean, would you characterize like our northern states, northeastern states, which are focus big budgets on healthcare, better about it than other states? I mean, you're from Arkansas, right?
I am from Arkansas.
You guys are
yes.
Arkansas based, which is fascinating.
Yes. I do find that some states are more progressive in their understanding, and you have to sell the concept a lot less, right? So there are some states I walk in and I talk about how social determinants of health are important and how women need access to doulas and lactation consultants and all of these things. So I'll walk into these offices and people almost look at you like, you're crazy. Like, what is this? What is the social determinant? What? You know?
Yeah.
And then I come in places in the north. I find this northeast that people know what that is already, and it's a very simple conversation.
And there are challenges, I'm sure, with implementation there also. But I just know in covering news in both New York and New Jersey that there is a lot of money allocated for these kinds of programs, right? And nonprofits, they do fund them, ones that provide these kinds of services. But, to the earlier point we were making, doesn't mean it gets to the right people, doesn't mean that they know where to look. And that's a big challenge, I think.
One of the things we're also hearing is that a lot of these hospital systems, plans, who have money to give away for this are talking to groups that say, well, here's an idea. And they don't have the tangible platform or the staff or the program built out. So we're hearing a lot of that too, to where it's just conceptual, and I think a lot of hearts are in the right place. A lot of people really want to help, and overwhelmingly when I have these conversations, no matter where I'm at, people are like, "All right, let's go! Like this is great."
It's a great idea, right?
It's just sometimes it takes a little bit of work to get it off the ground.
But that's what you're trying to do. In other words, you're one of the only companies actually doing this.
We are the only company that I know of doing this. Yeah.
Okay. Yep. Okay. So and is there receptivity to that? Like,
So
trying
far,
to hit the right word there.
So,
but bear
I
with
think
me.
that's a word.
Yeah, I think so. I'm not sure,
really good.
but I think so.
It should be a word if it's not.
I just invented it. So yeah.
But
you're getting a good reception. In other words, people are real when you're having conversations with people. They're understanding the importance of this and why they want to work with you.
Right, and it's important to me. It's personal for me. Like, we're women owned. I own the company. We're women owned. It's personally owned. We don't have like VC or private equity. And that's something to me that's important. I don't want to see a big private equity firm come in and monetize something that is not personal.
Takes away the personal touch, right? Especially with what you're doing.
Right, exactly. Because, these programs often, they're not cheap to run, right? They will pay for themselves over time, but, private equity will come in and how do we make this cheap? And it's not about that. It's about getting good services and setting the mom and baby up for success. I mean, these are lifelong skills, right?
Right. Well, private equity looks at everything in terms of how can you increase the margins here. It's not about whatever the service is. It's not about the personal touch.
Out of healthcare. Yeah.
I would argue that's probably not a great match. Tell me if you could, we're coming up on time here, but just a little bit about self-direction generally and whether that's preferred in terms of healthcare. Just tell us what it is and what's the better way to approach it.
So it's really an alternative. It's a type of long-term care service. It's an alternative to nursing home care or agency care. So individuals who qualify for self-directed care can hire their own worker. Most states will give them a budget of funds that, and most of those funds will go to the worker themselves to provide personal care, respite, and the individual, the Medicaid recipient, gets to pick who their worker is, right? It's not an agency sending a worker to them. They get to stay in their home where their outcomes are better.
I was going to say the value is really that, right? Staying in your home, not being in an
institution.
Right, an institutionalized in a foreign place.
The satisfaction's better. Right. You get better care.
Well, look what just happened with COVID, where we had all these deaths in nursing homes, not just in New York where it was worse than anywhere else, but people were in congregate situations where that's the risk you run, and maybe it's not as bad as a pandemic, but you are exposed to other pathogens when you're in a room with other people.
And mental health outcomes are also very poor, right? Because you feel put out to pasture. You don't have your stuff, all that all that stuff.
You're
So
out of sorts. Yeah.
You're out of sorts. So then you just do better. I mean, do worse. I'm sorry, physically. You just you're worse off. But self-directed care, you also can get people access to different types of services too. We can save up for people to build a wheelchair ramp or grab bars for a shower, those types of things. So
it's a better way to approach it.
It's a better way to approach it, and it has been growing and growing and growing.
And so it's relatively new. I mean,
well, I've done it for 20 years. So I've been at the company for 20 years. We've been doing it for. Actually, we've been doing it for 22 years, 23 years.
But it's grown, and other companies have gotten into the space, right? And
it has, and it's really interesting because there were a lot of kind of mom and pop groups, and because of all the regulations, there's all kinds of regulations around it now. It's been a little bit harder for, I think, some of the groups to kind of stay in it, right? So it's kind of dwindling down the amount of companies who can perform.
Right. There's a shakeout, like with everything, right?
Yeah. But I'm like the little man from Up, that movie Up. I am like the only.
It's a great reference.
Thank you. Yeah. Thank you. I'm the only female-owned company. We're the only female-owned company, and we're the only non-private equity. And I'm holding out, man.
You should. But that, I mean, just on the female health, I mean, that is a unique position to be in, meaning you truly understand this. I mean, you talked about your personal experience, like you draw on that, I would imagine,
Absolutely.
when you're understanding what kind of services are needed out there.
Yeah, and most of the caregivers on these programs, and again, we work in 19 states, we have probably 100,000 workers, right? And most of those caregivers are women. Yeah. They're women, right? And they're managing their family, and then they have this emotionally and physically exhausting job of caretaking. And, the benefits are not always great. The pay is not always great. And it's kind of a thankless job a little bit. So we try to do whatever we can to make it as easy as possible on these families.
Yeah, and I mentioned the pandemic, but that was another really interesting thing that came out of that, which was there was a realization in corporate America, and we're seeing it a lot, with all the companies that are based here in New York, that actually allowing people to be at home part-time and deal with their personal lives is a much better worker for your company. People are more productive because they're not worried about other things. Their mind's on something else. And obviously that has disproportionately impacted women in a positive way.
Yes. I am more productive. I can start laundry and then, get on some calls and put a chicken in the oven or something. I mean, it's great.
Because for many, many years, the workplace was designed by men for men. Right. And that seems...
doesn't work that way.
It doesn't work anymore.
And we will never go back to the office. Right. I say that all the time. Never go back. People ask me, no. I'm not going. Right. So nobody else has to if I don't go.
It's funny, every 6 months there's a news story, in the news about well, now this company's saying it's only 3 days a week, or now they're going back to 4. But the argument of going back 5 doesn't ever seem to really get back on the table. And anytime somebody tries to do that, you're competing also for work. Remember, there's a worker shortage there for a while, so you're competing.
Yeah. So many candidates ask about that.
Yeah, about work-home balance and how that's as important in some ways as salary, right?
Yeah, it's impossible. I mean, the demands are so great, especially on parents. I mean, as a parent, there's just tons of demands all the time. Yeah,
even just the emotional ones that are not physical in nature. But yes, right, exactly. It pulls you in a lot of directions, All right, we are going to leave it there. Alicia, thanks for being with us. We appreciate it.
Thank you so much. Appreciate it.
The Lobbying Insider Podcast is a production of David Off Hutcher & Citron LLP, New York State's premier middle market law firm, practicing in more than 20 areas, including commercial litigation, economic development, real estate, and government affairs. The podcast is produced by Don Tesserero, and our platform manager is Monica Thomas. Be sure to subscribe, and you can get it where you get most podcasts, including Apple, Audible, Google, Spotify, and iHeartRadio. Thanks for being with us.